As nurses and healthcare providers, we need to be up to date with the most current evidence-based practices. So in order to achieve and maintain this, we must institute a learning culture. It is critical to promote a learning culture in healthcare institutions in order to keep both patients and nurses safe.
You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Klara Culmone, Assistant Nurse Manager at the Laura and Isaac Perlmutter Cancer Center at NYU Langone Health in New York, about what oncology nurses should know about creating a learning culture in the workplace for nurses at all levels, from staff to managers and administrators. This episode is part of a series about creating a culture of safety. The others are linked in the episode notes. As a reminder, you can earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thanks again for joining us, Klara. We've had you on a couple times before, and here's our third installment. We've been talking with you about nurses' role in contributing to the Joint Commission's 3 factors in creating a safety culture, and today we've reached the third and final factor, establishing a learning culture. So to start, how does a learning culture influence healthcare safety?
As nurses and healthcare providers, we need to be up to date with the most current evidence-based practices. So in order to achieve and maintain this, we must institute a learning culture. It is critical to promote a learning culture in healthcare institutions in order to keep both patients and nurses safe.
So how can a healthcare organization create a culture that values and rewards this continuous learning among nurses and staff?
There are a few ways to demonstrate to nurses that a healthcare organization values and promotes a learning culture. So, for example, allowing paid time off to attend relevant conferences, including covering costs such as transportation, registration, etc., as we know that these costs can really go up quickly. In our department, it is also required that every nurse obtain at least 15 CEUs annually. So we are upfront with the staff about the expectations and values that the department holds when it comes to keeping up with new knowledge. Another way is to provide a financial incentive for holding a specialty certification. So this could be an annual certification bonus, for example. And lastly, offer opportunities to use educational projects that can be used to be promoted up the clinical nursing ladder within their institution.
I think those are all great ideas. And while I'm certainly biased, I will admit that I know that oncology seems to be moving at light speed these days. And so staying up to date is a huge priority for our nurses. And I think that organizations that help prioritize this and help clearly show that they support nurses in this endeavor are certainly shining stars of valuing nurses and what they need to do to stay current in their practice. So we love to see that. What are some types of resources and support systems that should be in place to help foster a strong culture of learning within healthcare facilities for their nursing staff?
So institutions should really have up-to-date policies and procedures that are easily accessible. Ideally, this should be in the electronic medical record or the institution's internal website, just something that is easy to navigate while a nurse is very busy doing patient care. Another example is conducting regularly scheduled in-services with the nursing staff. So this can be related to new drugs and treatments, but should also be refreshers of current practice with any pertinent updates. And then lastly, this is something that we do here, which I love. It's a clinical update bulletin. So these are critical policy updates, practice changes, safety alerts, anything nursing related that is sent out to all the nurses within the organization on a regular basis.
I love that. And I think it really highlights that it's important to provide opportunities that meet different learning styles as well and learning preferences. Some people, if they have time, they do like to go to those live in-person learning sessions where you have a live facilitator right in front of you. Others having that access, that digital access through the intranet or an electronic health system where you can kind of access that from wherever you are. That's great. I know reading sometimes is a preference. So having a newsletter or journal articles, things that you can read and kind of digest at your own pace. So it's great to have all those options. It sounds like your organization provides those. And I'm sure many other organizations have similar options as well.
Absolutely.
Can you provide some examples maybe of a successful approach to seamlessly incorporate education into nurses' daily routines, such as like maybe staff meetings, morning huddles, or other forums?
Yes, absolutely. And you touched right on it where we all have different styles of learning. So we really need to incorporate these teaching moments whenever possible. So staff meetings should be held at minimum of once per month and offer resources and links with the minutes that are sent to staff via email. So that way they can reference it on their own time. Some strategies that have also proven successful would be the on-unit learning, hands-on training. We typically allow a large block of time to get certain competencies done with the nurses, so that way they can attend a few at a time. Allowing time off the unit with the adequate coverage is really critical, and I think that's a challenge that many of us face right now. So staffing may not always allow for it, but trying to have a plan set in advance can really help ease this challenge. So some things that we have implemented to minimize staffing impact on the unit would include perhaps paying the nurse to attend a class on a day outside of their scheduled shift. So this is especially helpful for remote learning, or even asking per diem or part-time nurses to pick up additional shifts, whether it's a full or partial shift, really anything helps. If there is a new initiative, we can assign a champion of the new knowledge, and then they are responsible for providing that one-on-one education to the rest of their colleagues. So we really see that nurses use these learning culture-based promotion projects to benefit not just the individual professionally, but also the team as a whole.
And I think you've really emphasized the importance of providing that dedicated, whether it's physically off the unit or just like known to be outside of the patient care environment. That's a huge, important point that I think nurses need, because it helps them validate that like doing this learning, this additional learning, this continuous learning and education, it's a requirement, it's a necessity, and it can't just be kind of hopefully fit in whenever maybe it's a slow moment on the unit, which we know never happens. And so really being intentional and thoughtful about trying to find ways to dedicate this time to the nurses is just like, I think, the most important point to drive home of gone are the days where maybe you can fit it in after you get your, assessments done and your medications passed. Like, I think that that's not fair to nurses for them to have to kind of do both things at once. They need that time that's not dedicated to patient care so they can be completely focused on the learning at hand. So I think you've given some great examples of how that can be done. And I just encourage any leaders that are listening to try to find ways to do that for their own staff, because that really is critical in showing nurses that this is valuable, this is important, and it needs their dedicated focus when they're working on these types of things. So speaking of leaders, are there any specific leadership qualities or actions that nurse leaders can demonstrate to help encourage and maintain this culture of continuous learning among their staff?
Definitely. Nurse leaders are really critical in the development of a positive learning environment. Nurse leaders should conduct a learning needs assessment within their team and then tailor the educational plan based off of the results. And this really ideally should be done in collaboration with their nursing professional development specialist. So it's important for nurses to share new knowledge with one another. So one example that we like to add is that when nurses attend a conference or a class, we ask them to create a presentation, which is then shared with their colleagues during unit practice council meetings. And nurse leaders really need to provide time for this to be done, and maybe give the nurse a little bit of time on the side where they're not providing direct patient care to kind of collect all of the materials that they received and learned from the conference, provide a really comprehensive presentation for their colleagues. And then on the flip side, talking about setting a positive learning environment, we do need to address that there are near misses and mistakes that happen on the unit. So we really need to take those and use it as a learning opportunity rather than a punishing story, because this helps with creating a culture of safety. We need to include safety stories during our huddles. So those are done usually in person on the unit at the beginning or end of a shift, so we have maximum staff participation and attendance. And then lastly, we do encourage the staff to use downtime whenever possible. So for us, I work in an ambulatory setting, so we do schedule things towards the end of the shift when most patients have been discharged. I do understand that this can sometimes be challenging, though, especially at the end of a very busy shift. So we do try to limit the length of these sessions to under an hour to avoid burnout and information fatigue.
I'm so glad you brought up the idea. I mean, I think continuous learning can happen in all different ways. Learning about something new in your practice or in the science of the specialty that you work in is certainly important, but I think you've brought in a really important concept of learning from these near misses, or unfortunately sometimes actual errors that have happened, making sure that you're reinfusing the lessons that can be learned from those experiences so that you hopefully avoid them from happening again in the future. So it's so important over the course of the whole series that we've talked through this, of just creating that environment of psychological safety to be able to say, this happened or this almost happened. What is your process for reporting those things so that those lessons can be harnessed and kind of reinfused to the staff so that, again, everyone can benefit from learning from those episodes and contribute to creating a safer culture altogether. So I think that's a really great important point to keep in mind as well. How do you see healthcare facilities and nursing schools collaborating with healthcare institutions to demonstrate or strengthen their support for nurses' continuous learning?
One of the best ways for nursing schools and facilities to collaborate is by hosting student clinical groups. Having nursing students work with nurses allows the nurse to share their knowledge with the future of the nursing workforce. They are teaching a new generation of nurses. I mean, many of us remember the best clinical experiences during our training, and it is always the preceptor nurse who spent the most time teaching and answering our questions that gave us the motivation and drive to continue learning. So other examples include collaborating with nursing schools on DMP projects and PhD research studies. These are great opportunities to implement new ideas on clinical units. Also, utilizing the simulation lab to create scenarios in order for nurses to keep up with their skills. So, for example, mock codes or emergencies, hypersensitivity reactions, or even chemo spills. Healthcare facilities can also offer a tuition remission or reimbursement program. So with the increasing cost of higher education, this would allow for nurses to have an opportunity to seek an advanced degree. And then lastly, immersion programs and externship programs, which are typically done at the end of a semester or in the summertime. This really gives an opportunity for nursing students to work even more on a particular unit and get to know a specialty and work with the frontline staff on a more full-time basis for a period of time.
I think you've shared so many great examples there. The one that my brain kind of latched onto, though, was just the notion of hosting students, whether it is in a formal clinical relationship with a school of nursing, whether it's welcoming those graduate students to help with their projects that they're trying to conclude. And then also, as you mentioned, like immersion experiences, internships, externships, those types of things. What I think I'm hearing as being very important about this is just the image of nursing and what that means. And are we attracting new nurses to the field? ONS, we've talked about some of the sort of nurse influencers that we see on social media and how they're not always shedding the most positive light. I mean, sometimes it's realistic. So it's not that we want to paint it, rose-colored glasses type of thing. But I think we still need to be able to highlight the positives and the great parts about nursing, even though we know it's tough, even though we know we're experiencing challenges as a profession right now. But anything that we can do to give potential nursing students or already actively enrolled nursing students a glimpse of what it's really like. And yes, there's negatives, but there's also lots of positives, and just trying to create that welcoming atmosphere, because we do want and need more nurses to join the field. And so we have to be able to balance our challenges and maybe frustrations that we're currently feeling in the profession, but balance that with some of the great positives and the wonderful gifts that this profession brings. Being able to share both of those with anyone who's interested in learning more about nursing, I think we need to try our best to give them that balanced perception of what it is to be a nurse, because obviously we all are doing it and we love it. And we had a reason for starting this journey for our career. And so we just need to provide that opportunity for any other students who are thinking the same thing.
I agree with you, Jamie. And I think especially in the oncology field, it's really important to provide clinical sites and units and locations that are in the oncology specialty, because I think that's something that students don't typically get to experience during their schooling. And so many students that I've encountered over the years towards the end of an immersion program or an externship, or even the community health clinical students that we host here, they tell me how pleasantly surprised they were with working with our patient population, and that many of them actually shift the specialty that they want to go into as a new graduate.
I think a lot of programs have shifted just because we need more clinical sites, and the inpatient units can only take so many nursing students at once. But I also think it's important, especially for oncology, but for really all subspecialty care, is that so much of it now happens in the ambulatory space, at least like the management and the continued oversight of those disease processes that happens in the ambulatory space. When you're inpatient in a hospital, usually something has not gone wrong, but like something is not managed well, or maybe you're being newly diagnosed. Certainly there's certain cancer therapies that have to happen in an inpatient setting, but so much of nursing care is happening now in this ambulatory space. And so we need to be able to provide those experiences to nursing students, because we're hiring new grads in these areas, even in oncology. We've talked about this as well. At one point, oncology was sort of this specialty area that you really didn't go right into. You waited after you had a couple of years of experience. Now, while that is obviously a great path to still follow if that's what you're called to, but, we are hiring new grads right into infusion centers. And so that's okay, but we need to be able to provide some of that oncology foundational information, those experiences of what that type of work looks like so that nurses can intelligently make those decisions with the right information at hand. So I think everything you've said is just really backing up that need to get new nurses, nursing students into all areas of nursing, because that's what makes the profession so great, is that there's numerous ways to sort of live being a nurse. You just have to find the one that is right for you.
Couldn't agree more.
So do you have any maybe special noteworthy outcomes or success stories from collaborations between healthcare institutions, schools of nursing, things like that?
Yes. So a few years ago, we collaborated with 2 DMP students on their project, which was the creation of an ambulatory course elective that was offered at the College of Nursing. And part of that course included an immersion program, which is a 2-week intensive clinical on the outpatient infusion center. So the students are paired up with a primary nurse preceptor. So we've had this program in place for about 4 years now. And, I think we talked about this already, but that culture change and shifting that idea that only experienced nurses can work in an ambulatory infusion setting, that's not really the case anymore. So with the proper training of our preceptors and the carefully designed orientation plan and agenda, we were able to get buy-in from our nursing team to train these new graduate nurses. So we have been working with new graduate nurses in the ambulatory infusion setting. The orientation was very long, but very comprehensive, and it really set the stage for success for these new graduate nurses.
I love that. I think that's just a great example of how to bring those opportunities in ways that maybe, historically has not been the norm in terms of rotations for clinical sites. But I think many sites are now starting to think more creatively of how we can welcome students into our areas, even if it's not been a typical place. Maybe they can't spend an entire semester in our clinical site, but how can we still give them a chance to experience what we do here and understand what this is like? So maybe at some point in their career, they might want to land in a space like outpatient oncology or someplace that is harder to get into and get that glimpse. So I think that's a great example. Well, Klara, as we approach the end of our episode, I like to always ask a few quick fire questions just to summarize some of the things we've talked about. So to start that off, as nurses, we must evaluate our own implicit bias, both with our own colleagues, as our patients. So is there anything specific about creating a learning culture that we should pay particular attention to?
So I think that just because we did something a certain way for many years, if the evidence is saying otherwise, nurses need to adapt. And we know that change can be hard sometimes, but as nurses, we need to acknowledge our own weaknesses or bias and do our best to get past that. On the flip side, we also need to be mindful of nurses' learning preferences and abilities. So implementing a learning culture is only successful when it is tailored to the specific needs of the department and the nurses.
I love that. And I also think it's easy if a certain nurse does not seem super engaged in learning or doesn't want to put in the extra effort or the time. I think it's easy to make assumptions about why that is. Oh, that nurse is lazy. Oh, she doesn't care. But, I think, again, stepping back and asking, being curious, what is driving that behavior or what is keeping that nurse from enacting those behaviors? And I think it's important to always find out more. Maybe this nurse is stretched way too thin at home. Maybe just the idea of one more thing on the plate just seems untenable. And so I think it's important to investigate those types of maybe behaviors or attitudes to help promote that learning culture, just to understand that, the work and the job and the career is just one part of a person. And sometimes there's other things that could be driving that as well.
Absolutely. And it's really important to have one-on-ones with your staff, especially folks who seem to be having a bit of a hard time to do a deep dive and kind of give them a safe space to do that on a one-on-one rather in a group setting like a staff meeting or a safety huddle. I would just really encourage all of our fellow nurses to just be open to new learning, open to new ideas, and willing to teach one another, because I think we really do the best when we build one another up, we listen to each other, and we learn from one another.
Those are wonderful closing thoughts. Thank you so much, Klara, for your time and all of your information today.
Thank you for having me.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, Visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.